inside that little gap in between the ribs. And we can trace the ribs up all the way down to 11th and 12th floating rib. When you get there, that's probably going to be quite tender, so don't put too much pressure in that area. Underneath the scapula, and you're going to come into one of my favourite muscles underneath here. What do you think it's called? Sorry, it's anterior. It's under there, don't forget about it. I'm going to pick up some lat, and reinforce the fingers, and get myself in a good strong position for some great fun for them. Pull through, keep the fingers in line with the ribs, up underneath the scapula. So many people will come in and say, I've got pain just about there. Have you seen people with that? It can be quite a difficult one sometimes because there is a lot going on. But back to the job at hand, which is this mid-thoracic. So last thing that we're going to do is another fascial technique, so it will be new to you, but it's a bit of cross-hand stretching. So again, with the mobilizations and things, you're pressing down on the thoracic spine, and occasionally I'm going to come back to that and just see how it's moving. Is it any springier than it was before? That's the technical definition, but you will learn to feel what you should be expecting to feel and what's different. We can do some cross-hand stretching as well, which also looks a little bit like that manipulation, which it's not. But for this, we want to make sure we haven't got an awful lot of lotion on the back. So we're putting some pressure in, down, and then in opposite directions. And that's giving that fascia a stretch. And there's different ways of doing this cross-hand stretch. You can just keep it static, maybe through a towel, and keep the stretch and hold it. Or we can move over the skin. Give it a bit of torsion to the fascia. Similar effect to cupping, I guess, because it's going to stretch the superficial fascia on top. I think the last thing that I'll show you here, I don't want to neglect the lats because they're a huge muscle. You can see that in the anatomy pictures. They're the only muscle that connects the hips to the arm, which is highly significant when it comes to movement in general. But they can be a fiddly muscle to treat because they're superficial, there are ribs right underneath, and it can be quite painful quite quickly. I'd recommend getting your forearm involved. I'll demonstrate this side because I'll probably be getting in your way the other side. Just make sure that you've got enough lotion on there, but not too much. And without going full bore, elbow into rib cage, we can use the broad shaft of the arm on the forearm. And you can put a good amount of pressure in. Just make sure body on the couch that you're communicating and let them know it's too painful. All good?
Yeah, it's good. So tight, like I just don't neglect your bodies, peeps.
That might not cut it though, so let's bring in some movement.
Oh, no.
You look at an STR. Similar to the one that we did up here, but this time the lats are the focus. Let's start proximally. So I want you to slowly bring this arm into abduction for me, please. I'm going to pull in with broad fingers, elbows locked into my sides, and I'm actually pushing off the couch with the hands as well. And I can feel that grottiness in there. Good, and then come back. All right, go again. Try to lock that tissue into the ribs without being too painful. Let me know if it gets too painful then. And back. Good, and again, and we can keep on going because that muscle inserts into the iliac crest. Don't forget that. Good, and back. Go again. All right, and because we're past just standard STRs, now we can bring in some massage and movement. So go again. Back, again. Back, one more. Okay, and back, and just bring your arm to somewhere that's comfortable for you.
Yeah, the last one was the money piece, that was excellent.
It's good to hear that as well because you can then just do that a few more times because you might get more feedback from what they say than actually what you feel. So let's finish with a bit of towel work as well. Don't neglect the towel work. So we've got some more of those compressions and just use that as a bit of an experiment to see what it feels like. Try it on a few different people. If you find somewhere that you think that might feel a bit tight, I'm not quite sure what I'm feeling, just give it some time and slowly sink in. And last but not least, don't forget the body rocking, which is ridiculously relaxing. And that is going to work on the neural level, on the nervous system level. If you note the hand position, we can give a bit of a stretch as well. So I'm pushing down and away with this hand, up, opposite direction with that one. Cross hands to make it more efficient for you. All right, there's a few ideas there for you in the way of